Hello and welcome to Single Payer Radio. I'm Paul Hoppy, broadcasting from the Habron Building in Louisville on the WFMP 106.5 Forward Radio Community Network. Our programs air every Monday at 2 p.m., Tuesday at 7 a.m., and Wednesday at 11 a.m. And we also stream our show on SoundCloud. The show is a project of Kentuckians for Single Payer Healthcare in conjunction with Physicians for a National Health Program through its Kentucky chapter. We produce this program because we believe healthcare is a human right. We advocate for a national, not-for-profit, publicly funded, single-payer healthcare system that works for everyone. The views and opinions expressed on our show are those of the speakers and not the station. Our station relies on volunteers like myself and your ideas and donations to keep us on the air. On today's program, we take a look at the Affordable Care Act, how it got started, and where it is today. The program will be moderated by Kay Tillow. Kay?
This is Kay Tillow. I'm with Kentuckians for Single Payer Healthcare, and you're listening to Single Payer Radio. Today's show will be a discussion of the Affordable Care Act. That is the health reform that was passed during the Obama administration in 2010. And we hope to bring some clarity to the issues around that particularly very long and detailed act that affects all of us. So today we have with us, there are four of us here, and I'm going to let each person introduce themselves before we start. Hamza?
Hello, I'm Hamza. I am a second-year medical student at the University of Louisville School of Medicine. I found this group, I don't know. It's been a couple months now, but I was a 2024 New England Physicians for National Health summer intern. And through connections I made there, I was able to find this group, and here I am now.
And Evan?
Hi, I'm Evan Hawthorne. I'm a second-year medical student at the Kentucky College of Osteopathic Medicine. I am a member of Students for a National Health Program, the president of my local chapter, and on the National Executive Board, and that is also what led me to join here as well.
And Paul?
I'm Paul Hoppy, and I'm the programmer for Single Payer Radio.
And I'm Kay Tillow, and I've been working on single payer healthcare for about 3 decades now as the way for us to gain for our country healthcare for everyone who is in the country. So Hamza is going to begin the discussion of the Affordable Care Act.
Welcome, everybody. Thank you all for being here, and I want to thank all of our other speakers as well. The setting is March 23rd, 2010, the beginning of the end, as some would say, or some steps that some have made towards a brighter future. That was the date that Obama signed Obamacare, or the Affordable Care Act, before it became passed later. But here we are, 14 years later, looking at the effects, and I think part of the reason for this discussion is with the recent election of President-elect Donald Trump. There have been whispers among the Republican Party on efforts to remove the Affordable Care Act, and a lot of misconceptions, misinformation. And so we decided to take a look at what has been the legacy of the Affordable Care Act, what caused it, what were the effects of it, and see if we can provide some more information on this controversial law. So just some recent numbers, as many as 21.3 million people have selected their insurance through the marketplace. That number is up. And so we are seeing record enrollment of insurance under Obamacare, based on some small polls that have been conducted by the Kaiser Family Foundation, looking at just data from January. As many as 60% of adults in the US report that they are in favor of Obamacare. And so initially, when it was signed into law, the goals included expanding insurance, or expanding access, reducing the cost of healthcare, and improving the quality of healthcare. Notably, Obamacare is a very long and complicated law. And so I want to touch on a couple of the positive things that it did, but in no way is our hour-long discussion enough to cover everything that was passed under Obamacare. So a couple of things that I want to highlight is that one of the notable benefits was that it expanded Medicaid eligibility and it maintained the eligibility for the CHIPs. And so I think specifically it expanded it so that all adults with incomes under, I think it's 138% of the federal poverty line are allowed coverage under Medicaid. And so there were a number of studies looking at that in the past. Utilization went up, access to care went up by expanding that. Although there were a number of blockades where it left it up to the states whether they wanted to expand Medicaid. Not all the states did, but the states that did expand it saw a number of benefits. It did a number of things like provide premium tax credits aimed at reducing the cost for a lot of people. Another notable thing that people remember also is that it covered a minimum of 10 essential health benefits that must be covered by most insurance plans in the United States, which was landmark in a time where the trend for healthcare was cutting off a number of people and cutting down services so that they don't have to pay that much. Like I mentioned earlier, it created a thing called the health insurance exchanges. These are state-run exchanges where individuals and also under the form of businesses can go to buy health insurance and compare plans among a number of plans that are available with different levels of coverage and stuff like that. And lots of other things, but I think, I will move on to a little more of the negative sides of the ACA. While it was a step in the right direction, it did also leave in a number of the villains of the healthcare story. So it did not provide any sort of things like price controls, did not provide leverage for the government to allow for bulk purchasing. It didn't have really control of the incentives that are driving up healthcare costs. So it left in things like fee-for-service. And there was another common, not misconception, but a lot of the things people like saying against the ACA was that it led to a rise in premiums. Now, notably, if you get into the nitty-gritty of that, there was a rise in premium, but it was for a number of reasons that I think we can talk about later. And so, Obamacare is a very controversial law. For some people, it was touted as a great step in the right direction. For other people, it was the worst thing that came. But we will, I think, open it up to the floor to see what people think and how they remember the Affordable Care Act.
Well, I remember it well because at the time, we, along with, thousands of other people across the country, were campaigning for the nation to adopt a single payer approach and to remove the private insurance industry from the system, thereby allowing the money that we spend to be spent less on insurance company executives and profit and more on the healthcare that we need. So we were involved across the country in the effort to do that. And we tried a number of things. We did demonstrations at insurance companies. We had a sit-in here at Humana. And there were people arrested in Washington, D.C., trying to get the Congress, the Senate in particular, to open up the discussion, to include the discussion about single-payer healthcare. So I remember it well, and it was a battle that took place, and we didn't get into that discussion successfully. And in fact, it's my opinion that what was passed has delayed rather than promoted the progress towards a real national healthcare plan for our country. Anybody else on that? Paul?
Yeah, it was a strange time for me because along that same time period, I had became so, I guess, fed up with the neoliberalism direction that the country was going. So being a longtime Republican, I completely switched parties and voted for Obama, and then became the person who was defending Obama to everybody that I knew. And I used to tell people that I know this bill's not going to be what we want it to be. I said, but has at least pushed the needle and got it moving in the right direction. So I give the Affordable Care Act credit for that. But like Kay just said, it kind of didn't really pan out the way we'd hoped.
I think I'm a bit too young to remember the political environment and the specifics of it, but during my reading, I do remember initially, I think when Obama was running, he did, mention single payer. I think it was on his mind. I think he was pushing it, but then as he sort of moved up, it definitely left his verbiage. And it seems like it wasn't totally exactly what everybody was going for. And it seemed like a very, smaller version, where the ideas will still there, but like Paul mentioned, that it's much more of a neoliberal version of what could pass of, we want to expand access, but we still want to make sure that, private insurance companies are the ones running the insurance plans. And so, when they claim that like, oh my God, insurance premiums are rising, it's the drivers of the cost are still in place. And so, yes, the premiums would rise.
While I wasn't really keyed in on healthcare in this country, I had an employee-sponsored healthcare program, and I was pretty happy with it. But I was really aware of the number of people who had no health insurance. And so I saw the Affordable Care Act at least doing something good in that regard. So it did get people insured that hadn't been before.
Yeah, Obama had expressed support for single-payer healthcare in 2003 at a Illinois AFL-CIO meeting. But when he campaigned for the presidency, he did not support single-payer healthcare. And he brought into the discussion the people he called the stakeholders, which were the insurance companies, the hospitals, the for-profit insurance industry, and all of the pharmaceuticals, et cetera. So he, from the beginning, planned something that included all of the villains of healthcare, the ones who are using it as a profit center rather than as a way to bring humane care to the people of our nation. So that was indeed the problem. The bill was written by Elizabeth Fowler, who at that time was an aide to Senator Max Baucus of the Finance Committee. And she came from the insurance industry, from Anthem Insurance Company. And afterwards, she went back to Johnson & Johnson. And so the bill is written in a way that really enhanced the profit making of the insurance industry. And we saw it right after it was passed that the profit making for the insurance industry really escalated. And of course, that strengthened their ability to have influence within the politics of the nation. So it's for that reason that I see it as the other thing, it didn't make it affordable. It's not bringing affordable care. We now have employer-based insurance costs about $25,000 a year, maybe 19,000 paid by the employer and 6,000 by the employee. And purchasing plans, I don't know those figures, but if you purchase a plan on the exchange, if you have an income above what is now, the set income, you will pay a lot of money. I know we ran into a couple that had one child at one of our single payer booths, and they said they were paying $1,400 a month for 3 people in the family. So it's not affordable, and there are high deductibles. And if you are in Medicaid, you are almost certainly going to be in a for-profit plan as well, because the Medicaid plans have been turned over to for-profit companies at the same time. So all of the problems of our healthcare system were solidified into the Affordable Care Act. And it had a promise of making it better. And while it did reduce to something around 20 million, I think, the uninsured, that's been climbing up again. It increased the number of uninsured, the people who nominally have health coverage but cannot afford to use it, which is the crisis of today. And that crisis, I think, is there are more people today than before the ACA that go without care because of cost. So it has not solved the nation's problem. That's my opinion.
Hey, can you, since you're the one that has such a grasp on the history of this strange saga, when Hillary Clinton was in charge under her husband's administration of some sort of healthcare program, how did that relate to what ended up being Obamacare?
Well, she was in the early 90s. She was put in charge of coming up with a plan by her husband. And so there was a plan that was formulated, which was basically managed care. It was, but it never got even onto the table to be passed because there was such opposition to it, even though it was similar to what was eventually passed. It was not, it also was not a good bill. And she also did not support single payer healthcare. I know when she spoke with people who were in the single payer movement, she indicated that she didn't think that it could go anywhere because it didn't have support. And when she spoke to the insurance industry, she said that single payer was growing and it had great support, and unless they agreed to her plan, they were going to end up being cut out of the whole thing, with the country going for single payer. So she also did not give us anything forward-looking in terms of the insurance. And that really, the heart of it is that no nation has established a universal healthcare system and kept the private insurance industry in the center of the control of the plan. And that's what we have. And it's growing even bigger while it's now taking over Medicare, which is now majority in private hands. And that privatization process was a section of the Affordable Care Act. There was established within the Affordable Care Act the Center for Medicare and Medicaid Innovation. And that center is headed by none other than Elizabeth Fowler, who wrote the Affordable Care Act. And that Center for Innovation is granted $10 billion every 10 years, $1 billion a year to do experimentation. And all of those experiments have been towards privatization, have involved private equity, venture capital, et cetera, in setting up experiments with Medicare and Medicaid money, supposedly to produce better quality and to save money. It does neither. It makes it worse. And, that's one of the biggest problems that we have, is that CMMI center is running rampant in the nation with setting up programs that are turning more and more of our healthcare system over to the private equity, private insurance company, private profit makers. And we have to remove them. I mean, that whole section of the Affordable Care Act, we should, in my opinion, we should replace the whole Affordable Care Act with a well-defined, improved Medicare for all that is set up with no copays and no deductibles, removing the barriers to care, and covering everyone, thereby removing all of that need for people to sign up every year. We're now in a process of Medicare open enrollment. People supposed to go and sign up, and we're also in the Affordable Care Act open enrollment from now, I think, until January 15, where people can choose a plan. And yes, Evan?
I was just going to mention how interesting it was to me personally learning about so many features of the ACA and how much they were derived from the original Hillary Care proposal. So while it never made it anywhere, many of the features that I think are some of the biggest problematic parts of the ACA were based on things that were originally proposed with Hillary Care, like the pay or play mechanism. She also had regional health alliances, which became marketplaces, and they had an option that really pushed the privatization, like the private sector, which eventually it became what is now Medicare Advantage, which, like you said, enrolls more than 50% of people enrolled in Medicare and is a massive problem.
For me, it's even the Medicaid, that at its base is a faulty program. And I know I have friends who say it was just absolutely wonderful. I have a physician friend who says it was so great because people who had untreated diabetes and all of these other things, they got to see a doctor for the first time, and the expansion of Medicaid did wonderful things. And I understand that. I think that at that time, another 400,000 people in Kentucky signed up for it. But it's a part of our accepting of such a low standard because Medicaid isn't fair. It pays a lower rate to the doctors and the hospitals for the low-income people and the disabled. I mean, what better signal is there that we don't value your life or your health as much because we're not going to pay as much? So it doesn't sustain the hospitals in the rural areas. We have a problem. We now have 700 hospitals in the country in the rural areas that are in danger of closing. And they've been closing down, their labor and delivery and their emergency rooms and all these other things. The Affordable Care Act does not maintain a healthcare infrastructure adequate to serve our people, whether it's the lack of care in rural areas or whether it's the deductibles and copays that are unaffordable, or the drugs that people can't afford. Our drugs have, the act did not allow for the negotiation to bring down the prices of the drugs. So, right, we've had people going to Canada to try to buy the drugs, right? And, instead we should import the Canadian system of holding down the drug prices instead of sending people to Canada to buy the drugs. Hamza.
I think I want to shout out one of our previous episodes that we did that looked at, where is the US at in terms of health outcomes compared to other countries. We have worse maternal mortality, lifespan is worse than other countries. Somehow we still spend more. And this is in context, we've had the ACA for so long, if it was as landmark in sort of longer term, it did a number of things, but, we are still at where we are in compared to a number of other countries. And so I think one thing I also wanted to mention is the CMMI. When it was established, it was big. You mentioned the founder had conflict of interest and stuff, but it's they tried to make it out to be this very big, fact-based, evidence-based new design that we're going to change and we're going to find the most efficient way. But here we are, 14 years later, and there are very few of their so-called experiments that have worked. They've only come out with, I think, 4 or 5 that could potentially be. They haven't adopted any of them either. And the problem is that, like you mentioned, that they maintain that sort of like fee for service, and they just tried moving around a couple of the players. And oh, if we make it just this market, if we just include this geographic area and just coverage for just diabetes, for example, maybe it would be better. But that undercuts the underlying thing is you still maintain that private insurance and fee for service style payment that is what's driving up costs in the first place.
I don't think that there's agreement on that, Hamza, because the value-based care is seeking to replace the fee-for-service. And that's the argument is that people get too much care because each particular piece of care is paid for under fee-for-service. But countries that have universal health care plans use fee-for-service, at least for some of their things, and they are not overwhelmed with cost. In fact, they spend less than we do. So it's the managed care which puts people into a system that allows the insurance company to get a fixed per capita rate that is driving the cost up, because they're using the capitation to set up a system in which they want to deny care because that gives them more that they're able to maintain. We've seen it's very complex, but in the Medicare Advantage plan, the private companies are overpaid something over $80 billion a year, and yet they spend less on care, and the government is paying more. So the whole system that was supposed to bring down the cost is in fact escalating the costs and worsening the care and inserting private middlemen into the decision making, where they have the ability to deny care by demanding that there be a prior authorization. So we have all of the bad features of managed care, and we didn't get the universal care that we wanted out of the Affordable Care Act.
Yeah, I apologize. I meant to say value-based care. One of the things.
Oh, I'm sorry.
Easily miss up. No, but it's good you corrected me, because there is a difference between fee-for-service and value-based care. But I think a part of it was the thing is, I agree. It's just like, they tried experimenting with these different forms of, they were just never able to find anything that was cost effective.
Mm-hmm. And what we see, the thing is that they're just really on the wrong path. They've set up something called the Learning and Action Network. And CMS, that's the Center for Medicare and Medicaid Services, brings together annually or twice a year the people, the executives from the insurance industry, the pharmaceutical companies, and the people from the academic centers that work on healthcare reform, the Margolis Center, et cetera, and past heads of the Center for Medicare and Medicaid Services, and they have a discussion about it, but always they include the for-profit industry as in the network for the discussion and the solution. And so we can't get anywhere because, the wolf is in the tent. We can't solve it because they insist that the industry be a part of the solution. They say you can't remove them. That's where we are. I think one of the things that Obama said is, if we were starting from scratch, we could have done single payer, but we're not starting from scratch, and therefore we have to build on the system that we have, basically accepting that the medical industry, the for-profit industry, has to remain at the core. And of course, that's where we disagree. That is indeed the problem, and that's what we have to remove, and that's why single payer. And we indeed have a majority opinion in our country that that's what people want. We just have to make democracy work in order to be able to enact it. which is
I
no
think
easy.
there are examples of, where the Obamacare identified the problems with the insurance industry. I think, one of the things people love talking about is the pre-existing conditions, you know. So people with pre-existing conditions, the 50 to 129 million that exist, who are at risk of getting cut off or, minimal insurance plans, because that is the incentive of the insurance industry. Why would you keep paying for such high amount of care these high risk individuals? And so, they at least made an attempt in there where you have to cover pre-existing conditions, because they recognize that, it is the nature of insurance industries that you don't want to pay for something like that. But it only stopped there.
Yeah, that's true. I mean, um, uh, before the ACA, there were people who couldn't purchase insurance at all, because they had one of those diseases that it costs a lot of money to take care of. Evan?
I agree completely with what you said about needing to get rid of the profiteering companies that can't be a part of the policy making if we're actually going to move forward to a sustainable system. Because I also agree with the statement that I think we should just get an improved Medicare for all bill. I think is absolutely the end solution here. But I'm going to do something out of character and defend the ACA because I also agree with Hamza. And where we are right now, we're facing the very real possibility that the ACA is completely destroyed. And I could talk forever about all of the problems with the ACA and all the ways that I would like to see it improved and all of the silly and or stupid things that it did. But at the end of the day, it insured a lot of people. It got rid of the pre-existing conditions thing. It closed the donut hole in Part D, and it was far from perfect. But the alternative is millions of people, millions of Americans could lose health insurance more or less overnight. And so it's not the end-all solution, but I don't want to see it destroyed.
Yeah, I'm with you, Evan. I don't want it to be repealed until we can replace it with a real national single payer plan. But I think that if we look at it, there, even that, the part about pre-existing conditions being covered, even that was never really real. Because, well, one of the things that I remember happened right away was that the plans would put formularies for drugs into their plan, and they would be on different levels. So your copay is higher if it's on a certain level. So they would put the drugs like for epilepsy or for MS or for other things that are expensive to cover into higher categories, so that people who had those conditions wouldn't purchase those plans. I mean, it was always fixed so that nothing was ever really totally true. The pre-existing conditions could be gotten around by adjusting the formulary within the plan. And of course, it was never taken out of the Medicap plan. So pre-existing conditions can be denied to people who are on Medicare. You can deny a person a plan if they've passed the initial period when they have to sign up. So the complexity is difficult. But even the things it was going to give us, so, there's been an expansion of those, I've forgotten what they're called. They're short-term plans that are exempt from the conditions, and that keeps expanding. So they're ones that don't have to meet all of those essential benefits that Hamza spoke about. And those plans can discriminate as well. And that's expanding. And I think Trump is in favor of expanding those plans as well. So there are a million ways around even the guarantees that were put in, just like they overturned that expansion of Medicaid to all of the states. So we have 10 states that didn't expand it. And, That's a huge problem. The Supreme Court did that. So that's a tremendous problem. And we have another problem that's coming up. I think it's at the end of 2025 when the special measures that were put into effect to subsidize people on the exchanges will expire. They were put into effect during the pandemic, and I think they expire at the end of 2025, which means that we're going to face another end of a period that raises the cost of care for so many people.
Yeah, I think there's been lots of efforts to just like undercut the ACA. Besides just these verbal attempts, I think when there was a vote to repeal the ACA, at a minimum they did remove that like tax penalty for the individual mandate part in 2017. And I think a lot of it is just they're slowly chipping away until they finally come upon the big vote to repeal the ACA.
Yes, well, certainly the direction of the Project 2025 that it comes from the Heritage Foundation and seems to be the Republican proposal is not moving anything in a good direction. It proposes that Medicare be totally turned over to the Medicare Advantage companies. And of course, on Medicaid, it proposes more work requirements, et cetera. And we already have, many states that have requirements around Medicaid that are so strenuous that people keep falling off of the Medicaid plans, even when they would be nominally eligible. So we have a lot of trap doors where people keep falling out of the healthcare coverage within our country. And the patches that many Democrats want to put on it are all insufficient to fix it, which is why we advocate that the nation take a look at what is the data about how you get a universal healthcare system. How does that happen in the country? What's the necessary underpinnings and foundation to have a system that really covers all of the people? And we're promoting that. And we think that we have to get there and that it's possible to do it, that it has been done in many other countries. I know someone said, it's so difficult to work out universal health care that only 31 of the 32 richest countries have figured out how to do it. So we want to join that band of nations that has decided that healthcare is a human right and that we have to find a way that all of our people can benefit from, the advances that we've made. I mean, we have the basis for a really excellent healthcare system. We have good hospitals and good researchers and good physicians and nurses and, an infrastructure, if we can keep it, that would allow us to have a really good healthcare system. And yet we don't have it. As Hamza was saying, we're at the bottom in terms of outcomes. And I just saw today that we were 5.8 years in life expectancy below the best performing countries. And there's no reason we don't deserve not to have the care that we have the ability to give. And that's why we're talking about single payer healthcare. So, but I would agree with Evan and Hamza and Paul that no, we don't want to repeal the Affordable Care Act. We want to replace it with the enactment of a system that would cover everyone and improve care for everyone and expand care and make sure that the barriers to healthcare are removed from people and we get to take care of everyone.
And there are lessons, we can learn from different parts. There's lessons we can learn from, obviously we've talked extensively right now about the problems with private insurance, but the, nitty gritty about, do we want cost sharing at all, right? So one of the things that the Obamacare did was that it allowed for evidence-based preventative services, and those would be available for no out-of-pocket costs, I think covered under Medicare. And so, there is a specific lessons that we can take where cost sharing is a problem, where it creates a disincentive if people have to pay anything. They don't want to utilize those services. And so, that's what is all about affordability.
Right. Right. That's true. That's definitely true. And, that's one of the things that almost all of the health policy experts in our country that are dominating the scene are saying, that there has to be skin in the game, that without it, the costs escalate far beyond, what can be done. And that has not proved accurate. That is, it's not proven at all that people will go to the doctor every day and want to go into the hospital, et cetera, that there is a limit on how much people will expand care if it's free, because it's not something that you want more of if you don't have to have it. People are not longing to spend their days in doctors' offices and hospitals. So the other thing is that, we get much less. We go to the doctor less. I think it's about 4 times a year is average in this country. And somewhere like Japan is like 12 times a year. And yet their costs are much lower than ours. It's not going to the doctor that causes the cost to escalate. And in fact, that's what we want people to do. If we get people into care quickly, that's where we can do preventive care and can catch things early and do the best possible to keep people healthy.
I maybe want to ask another question about, I think you mentioned it earlier, that lots of progressives, after the passage of the ACA, definitely did not put as much effort into fighting for single payer. I don't know if either of our members could speak to a little bit. What was it like after the passage and people's reactions to still fighting for single payer?
I think from my standpoint, I perceived it as such a good thing that it happened, because again, I wasn't really into it. I didn't really understand how it worked, and I certainly couldn't see all the pitfalls and the downsides to it. But so again, I was kind of satisfied with it. So why push for more? Look what we have now. Look what we just received.
It was implemented so slowly over time, because not all the provisions went into effect right away. And the Medicaid, I think it was 4 years before it was fully into effect. And the exchanges didn't go into effect right away. So it kind of unfolded and was unclear how things were going to be. And we had the what was it, that movement of people that went to all of the town halls and were screaming against Obamacare. What was that called? Oh, Tea Party. The Tea Party.
Oh. Right.
The Tea Party was, enraged about the passage of Obamacare. So I think many people jumped to its defense because that was such a brutal kind of opposition, and it was almost violent. It was. I remember we went to one of the meetings here that Congressman John Yarmouth held, and these were angry people. We had to go through gun control things before you got in, because there was a mood to rile up a lot of anti-feeling against the Obamacare. So I think that probably a lot of people supported it because they were so opposed to the brutality of that kind of an opposition. But we have to judge things on the reality of what they do rather than on what is seen. And I think that I really believe we have to raise the aspirations of our people to demand what is necessary to really solve the problem. In other words, there is, we can't patch the ACA. It can't be made to lower the rates. We spend about double per capita what other nations spend other wealthy nations spend on healthcare, and you can't put enough money into the system to fix it. I know Dr. Marcia Angel always said that. She said, anything you do that improves the care is going to cost more, and anything that you do to cut the costs is going to cut care unless you go to single payer. And that's the conundrum that we're in, that we can't, it's not fixable within the structure that it's in. To improve care, it will cost more, and we're already paying too much, and it's beyond the ability of many people to pay. So we have to do what the right thing is. And you can't base healthcare on market decisions. And I think that that's really an important thing we have to learn. I think it was Uwe Reinhardt that said, well, here's how you choose your plan. You decide what conditions you're going to have and what illnesses you're going to have in the coming year. And then you choose the plan that covers those. And if you can't find one, you go back to the beginning and you choose different conditions and different illnesses. And he's right, making a joke of the fact that there is no way that you can know what you're going to need. And therefore, all of this choice about what plan you want is not helping us. We need to cover what is medically necessary for that person. And that we don't need to be making a decision every year. And it's horrible that, we have to listen to these TV ads about Medicare Advantage and choose this, choose that, this one's best. You can't choose. There's no way you can make that decision. Hamza?
I think probably most of the listeners know, but I think it's worth maybe spending a little bit of time on that, the economic principles that undergird, for-profit motivation do not apply in the realm of healthcare. You know what I mean? Like you mentioned with your joke that, when you have a condition, you don't get time to shop around. You have time. It is there. You choose what is the most available to you, and you just go with that because it is critical to you. And so the sort of, supply demand curve is very different when it comes to something like healthcare.
Right. That's one of the problems. And we shouldn't have to choose every year. We should have the same plan, everybody in the same plan. That's one of the things that people have discovered, is that if you put the politicians and the wealthy people in the same plan with the rest of us, that everybody has an interest in maintaining that plan. And while many countries are struggling to keep their good health care, that principle is true. And therefore, it shouldn't be means tested, like Medicaid is means tested, which means that there are all kinds of limitations for the people who have to use that as their health care plan. So we want it to be good quality, and all of us in it together, and then all of us with an interest in keeping it the best possible plan that we can make it.
There's an interesting parallel there in education in Europe. There aren't a lot of private schools in Europe like they are here. And certainly, we're always moving to get more and more private schools and even use public money to finance them now. Thankfully, that was soundly defeated in Kentucky. But and the theory is that the people realize that their children should go to school with all their children, because they're going to have to live with them in their society. And it's kind of the same thing with healthcare. Like you said, let's put the rich people in so we all share equally, and hopefully building a better society for everybody and not just a few. Even though the wealthy people in Europe, they realize that usually their kids are going to be the bosses, and those poorer kids are going to be the workers, but it gives them a better understanding of why they need to be fair to those people that are their workers. I just thought it was an interesting parallel.
At the most basic level, you're talking about another human right. We're talking about health insurance and healthcare. It's a human right. Education, also a human right. You should not have tiered options for something that is a human right. We should all get the best possible.
I think that's a better way to say it. I kind of got tongue tied there trying to explain. But yeah, you're right.
We agree on that. That's a true thing.
We all understand the problem here perfectly well, and I think most of our listeners do. Of course, the big question is, what do we do about it? And we talk to a lot of people through our surveys and our festivals that we attend and our outreach programs. And like Hamza said, better than 60% of the people agree with us in this country. But we don't seem to go anywhere with this. You talk to somebody and you ask them, my favorite thing is always approaching a stranger. Do you think our healthcare system is kind of a mess in this country? And, without fail, they say, yeah, it sure is. And that's about the kindest way they say it. Usually it's a profanity laced indictment of our healthcare system. Why can't we do something to fix that?
I definitely think the momentum is there. Each year we keep in these surveys, we keep people want sort of single payer or some sort of like national coverage. But in these metrics, we just keep getting worse and worse and worse. And so I think it's people realize they're not getting anywhere. And it's not just a national scale, what I mean? It's the individual scale, like Paul mentioned. We talk to people and they're just not satisfied with their health coverage. They're paying a lot. They are having to deal with denials of service, having to deal with who is in network, who is not in network. It's very complicated. And so, making it simplified and easy to understand is also part of it. Not only does it deal with the national metrics of cost and coverage, but it makes it much easier on the individual level as well for somebody to manage that sort of system and get the preventative services and access the care that they need. I have a controversial, or I guess, question. Is there a world where, where if, say, for example, they do get rid of Obamacare and people are left and we have a large number of uninsured, that maybe that would push more people to advocate for single payer?
Evan.
So this is something that I have talked about with a number of people recently in light of the election and talking to people as they process it. And obviously, do what you have to do, and it's different for everyone, but mourn whatever you think you've lost. But the silver lining that I am clinging to is the hope that this situation represents a type of, like, the night is darkest before the dawn type of situation, where it's going to be, in all likelihood, a rough 4 years. Things will be bad. Things will get worse for millions of Americans. And I'm hoping that if we act on people are already pretty disappointed in Democrats and how things were working. And so if we communicate clearly the way that Trump's decisions have actively worsened the situation, and we go, look, neither of these options have worked. What if there's a third option? What if we can do it a different way entirely and kind of push more or less common sense populist policies that, maybe what is definitely a rough 4 years could be the best 4 years for organizing and mobilizing that have happened in my lifetime, for sure. More than just for health insurance. I think the same way for climate change. Things are only going to get worse. This is the most important time and the best time to get out and explain to people what's happening and how we can make it better.
I agree, Evan. And one of the keys is that people have to understand what we have to enact in order to fix it. I think a part of our problem is that there are people with the illusion that we can patch up the ACA, that we don't have to do very much. We just fix this and fix that and expand Medicaid and do this. And I think we have to use our understanding of health policy to help people to understand what they have to push for in order to be able to get the system that we need. And, I think that we can do that. And that's a very hopeful thing. I think that it's going to be very hard for them to try to repeal Obamacare. They may be able to, do some things. Certainly there'll be damage. We get damage all the time. But I think it would be hard just to repeal it without replacing it. And Trump says he's got some concepts somewhere. But there hasn't been a plan that has emerged since he has said he wants to replace it with something beautiful. So who knows? It's really unknown where he's going, but a big piece of where he can go is dependent upon what we can do to put the grassroots of our nation into motion for the just policies in the climate and healthcare and economics and education and all of the areas that we care about. So thanks for the hopeful note, Evan.
Well, Evan, I just want you to know that I've been getting the same sort of sentiment from people that I've been talking to also. So yeah, I think you're right. It's out there, and when things get so bad, maybe then we'll move in the right direction. We'll be forced to.
That is good to hear. That's why it's never been more important to, form those networks, be active in your community, reach out to people because people need help. And while you're helping, explain how we can do things better next time.
And the other side of this is that there, in any movement, it has to have a champion. It has to have a strong leader, which we don't have. And hopefully in the next 4 years, somebody will emerge that we can rally around. It happened for the right. It happened for the MAGAs. Why can't it happen for us?
I think we can put a lot of people into motion. And, one of the things that's true is all these rural areas that went so strongly for Trump, they're really hurting under healthcare. I just saw the figures that, the lack of access to care in those rural areas, they're hurting worse than anyone else. And if we could move those people to understand and to help us push, we could really do some change in this country.
Well, he has promised to fix all of these things, and we know that he can't possibly do that. So the people who supported him, I think they're going to lose faith pretty quickly in him.
So the people have to lead, and then the leaders will follow. Okay, well, you've been listening to Single Payer Radio. We're Kentuckians for Single Payer Healthcare, and you can reach us on the internet at kyhealthcare.org. Thank you for listening.
Thank you, Kay, Hamza, and Evan for joining me in today's program. Please join us next time for Single Payer Radio.